what is public health? There could be some confusion about that, and that was an item of discussion when I was in residency. Public health consists of looking after the health status of populations or communities. It does not consist of taking care of the health status of individual patients, of individuals. And that's a very important difference. It's a very important distinction to make. Public health is not really clinical medicine except in a limited number of instances. It's not primary care. But I became interested in what the norm is in the state of North Carolina because I was aware that our own county health department, as well as certain entities established under the county health department's budget, that they're involved in providing a lot of clinical care and primary care. And I wanted to find out what the lay of the land is. What is the norm in the state of North Carolina? And I decided to call the State Division of Public Health, and I spoke with Dr. Jeffrey Engel. And what he told me is that of the 100 counties in the state of North Carolina, about 40 of them are engaged in providing primary care services, 40 out of 100. He then suggested that I speak with someone else in the department. I was interested in finding out what is actually mandated by the state for county health departments to do. What do county health departments have to do in the state of North Carolina under state law? And he referred me to speak with Chris Hoke, who is the legal counsel for the State Division of Public Health. And I spoke with him. And while we were on the phone, he had me pull up on the internet the North Carolina Administrative Code. And it was very interesting because it turns out that in the state of North Carolina, what county health departments are required to do is quite limited. And I have them listed here. These are the core areas that represents what what public health consists of in the state of North Carolina. Vital records registration, food, lodging, and institutional sanitation, communicable disease control and immunizations, individual on-site water supply, sanitary sewage collection, treatment, and disposal. That's the core. That's what the state absolutely requires. It gives a lot of wiggle room on just about everything else. And it was interesting because the administrative code also specified what the minimum level of staffing has to be in a county health department in the state of North Carolina. And it turns out that to have a county health department in the state of North Carolina, according to state law, you only have to have 4 employees: a health director, a public health nurse, a registered sanitarian, and a secretary. That's it. That's all you have to have. Now, let's look at the county health department here in Guilford County. We have a department that has a budget of nearly $37 million. There are more than 400 FTE equivalents budgeted for in the county health department budget. We have nearly 100 programs funded as line items. Those represent nearly 100 separate activities that the county health department is engaged in. So you go back to this, and you look at that list of the required activities, and then you look at the number of activities that we're involved in. There are clinical activities taking place, both by the county health department and also by certain entities that are funded through the health department budget. So you have the health department, Guilford Adult Health, Guilford Child Health, and even the new Southeast Clinic. These are all engaged in providing clinical care and providing primary care. And it turns out that these entities see patients who have insurance. You would think that it would be for the medically indigent who don't have insurance, but that's not the case. They see patients who have insurance, and in fact, they bill insurance and they collect from insurance. Very interesting, both public and private insurance. So in essence, these entities are competing with the private sector. We have a vibrant, very active, very comprehensive private medical sector here in Guilford County. I'm not a part of it because I practice in Rockingham County, but we have everything that there is to offer, and yet we have a public sector that's essentially competing with the private sector. Now, what is the approach that I looked at in terms of trying to pare down what it is that we're doing with the county health department? And the approach I took was that I basically decided to look at eliminating those activities that are not mandated by the state. And that's what we did. And what we found was that above and beyond Brenda Jones Fox budget, we were able to save approximately 9.3 additional millions of dollars for county taxpayers. Now, I would just like to close on a personal note. I was born and raised in New York City, and during the 1970s, I was a student in the public high school system. And during that time, some of you may remember that the city of New York was on the verge of default. And in fact, they needed a bailout, and they had to get it from the state. But the condition was that there was a financial control board that essentially took over the finances of the city of New York for a period of time. After hearing George's presentation, I think we have to be concerned about what our future is going to be in this county. I think we have to be concerned, what is it that we're going to be vulnerable to if we keep on this cycle? And I would just ask our commissioners to think about the ways that we can avoid that scenario, the ways that we can demonstrate stewardship, keep the tax rates down so that we can continue to attract jobs. And I would just ask everyone to consider that. Thank you.
Questions from the commissioners?
On the $9 million in cuts, are you looking at abolishing the programs or reducing the number of programs? Or are you looking at keeping some of the programs in place? Or
I would refer to it as $9.3 million in potential cuts. Obviously, this would be your all decision to make as far as what things are eliminated and what is not. But we have laid out in the package the things that we suggested, and it really involves programs in pretty much all of the program areas in the health department: community health, clinical services, allied health, environmental health.
but now that 9.282, that isn't all the non-mandated programs in the health department.
No.
There's a much larger number. So apparently you picked out certain ones that you felt could be done away with.
Right, and this represents county money. There's a certain amount of money in the health department budget that comes from other sources other than the county.
Question.
Sure.
Where do I find the list of those items that you propose to eliminate? In here?
It'll be in the packet, yes.
In which packet?
What you've been given in section 4, I'm
In
told.
this booklet?
Yes.
Could you tell me where?
I don't have that, but
Oh, it's in,
In section 4, there is a line-by-line budget, and by each department, every line where we identify an opportunity for tax reform, we've identified it on that budget. In section 4.
Are there any more questions for Dr. Guarino? We all done? Okay, thank you very much.